Palliative care is a type of medicine that focuses on the quality of life of people who have a serious and progressive illness. The main goal is to try to decrease the symptoms, whether they be physical, psychological, spiritual, of that patient, and as well help that family that is accompanying that patient throughout the course of the illness. Which means that this could happen right from the beginnings of the diagnosis of the illness. When palliative care was first started back in the 1960s, it was truly reserved for dying people. Fortunately, medicine has become much wiser. In the last 60 years, we have better understood the medications that can be used to help relieve suffering, how to dose them, how to increase them when necessary, and only when necessary, and also the side effects that they might cause. As well, we now have courses specialized in the delivery of palliative care for medical students, for young physicians, and even for physicians who are already practicing but would like to learn a little bit more about palliative care. So the medications are now prescribed in a very safe fashion to make sure that patients are getting the benefits and have minimal side effects. So palliative care is the kind of care that can be offered right from the get-go when the diagnosis is first placed, and can be offered by the treating physicians, whether these physicians be family physicians or specialists. A cardiologist could very easily prescribe morphine for the patient's shortness of breath when they have some heart failure. However, it is true that the palliative approach can take a little bit of extra time and sometimes takes a bigger team of people who are specialized in how to deliver this kind of care, the specialized palliative care team. And the treating physician may not have that expertise or that team or that time to be able to provide that kind of care to their patient. At that moment, the treating physician may refer to the specialized palliative care team. And as I was mentioning, it's a group of different healthcare workers who come from different backgrounds, such as physiotherapy, from nursing, social work, psychology. All of these people are there with their expertise to help with relief of suffering and accompaniment of the patient and the family. As well, when the condition of the patient requires it, the patient can actually get home care, palliative home care, to be able to have all the nurse services necessary in the home for as long as possible. In that way, with follow-up treatment in the home, the patient doesn't need to go to the emergency room in times of crisis and can avoid unnecessary hospitalizations, therefore have much better quality of life in their own home. That really improves on that patient's life. Now, surprisingly, what we've seen with research is that palliative care offers more than just relief of suffering. They actually conducted a research study, and when they offered palliative care to a group of people who had advanced lung cancer, those people had less anxiety, less depression, and of course less symptoms, but surprisingly had an extra 3 months of life on average compared to those people who did not get palliative care but just had treatment from their oncology team. So palliative care is about improving symptoms, but it may surprisingly also give an extra bit of time. Palliative care is about accompanying the patient, the family, improving quality of time. We are there to support you throughout the illness, right until the very last breath.